Multiple sclerosis is a disease of the central nervous system, interfering with the nerve impulses within the brain, spinal cord, and optic nerve. It is one of the most common diseases of the central nervous system, with over 23,000 people living with the disease in Australia. Currently, there is no cure available. However, there are several treatment options to help manage symptoms. Fatigue is one of the most common symptoms experienced by people with multiple sclerosis. Studies show that 75 to 90% of people with multiple sclerosis experience fatigue. Participants described fatigue symptoms as frustrating, overwhelming, and disabling, and these symptoms affect their occupational and social performances and plays a major role in their inability to maintain employment. Occupational therapy aims to optimize a person's engagement in occupations required for various life roles. Energy conservation interventions is a non-pharmacological intervention for managing fatigue symptoms. Occupational therapists can assist people by performing task analysis and modifying behaviors that increase fatigue, helping patients cope with their fatigue and still be able to engage in everyday activities. My review question was the effectiveness of occupational therapy interventions for fatigue management in people with multiple sclerosis. I used electronic databases to search, and they included OT, Seeker, Medline, CNAL, and Cochrane, including discipline-specific journals such as American Journal of Occupational Therapy, Multiple Sclerosis Journal, and Clinical Rehabilitation. Some of my search terms included multiple sclerosis, fatigue, energy conservation, occupational therapy interventions, multiple sclerosis symptoms and treatments. The articles used were published between 2005 and 2014, peer-reviewed, highest level of evidence, and I used articles from the Systematic Reviews reference list. So the level of evidence for the systematic review, it is level 1 evidence, and the randomized controlled trials are level 1 and 2. Available evidence for the intervention, published between 2003 and 2011. There's a great number of high-level evidence research articles available. Only level 1, 2, and 3 evidence was used for the systematic review. Unless no other evidence was available, was level 3 and 4 incorporated. The quality of the evidence for the systematic review was of good quality. All the important criteria were addressed. The author's search strategies was relevant to the research question. All searches was done and confirmed by a medical research librarian with previous experience in completing searches for systematic reviews. Relevant databases were used. Their inclusion and exclusion criteria was not too broad and clearly identified what was used. The conclusions they reached supported the results of research done, and they provided further recommendations for occupational therapy in the future. Both RCTs received a score of 5 and above on the Pedro scale. It was of good quality. The authors addressed possible limitations, included a section on how sample size was determined, intention to treat analysis, and outcome measures was described in detail, including their reliability and validity. Possible sources of bias. Because instructors and therapists were not blinded, there is the potential of assessment bias. Therapists could exaggerate outcome measures. Not blinding of the participants could have an effect on their perspective by under or over-reporting outcome measures. The blinding of the assessor could reduce the potential of the above biases. Reported outcomes were that energy conservation courses were found to be effective in reducing fatigue symptoms and improving people's quality of life. Participants benefited from the new skills post-intervention and improved their scores of outcome measures. Participants also valued the peer support they received from the course. Hearing success stories from others improved their self-efficacy for performing energy conservation strategies. The contents of the course were relevant and useful and meaningful for everyday life. It is also important to include that some participants found it difficult to complete the practices at home. The lessons learned is that for occupational therapists, they can use group fatigue management courses delivered either face-to-face or long distance to reduce the impact of fatigue on clients and improve their quality of life. Occupational therapists can use these courses to emphasize the balance between person, occupation, and environment. The interventions can benefit from some further research into the benefits of the length of the intervention. So far, only one study measures the long-term effects. The evidence provided supports the intervention and the role occupational therapy can play in assisting people with multiple sclerosis in addressing fatigue symptoms. However, intervention should be client-specific and not generalized, as every individual's case of multiple sclerosis is unique.